Good evening, everyone. My name is Janet Pichardo. I'm the Director of Family and Community Engagement for the Providence School District. Buenas noches a todos. Mi nombre es Janet Pichardo. Soy la directora de Asuntos Familiares del Distrito. Thank you so much for attending our Parent Academy this evening. Our topic is exploring healthcare careers. And those that were invited were specifically our high school students and parents. So we're hoping that you'll definitely leave this workshop this evening knowing a little bit more about the opportunities that are available here in the state from our presenter. And I will allow her to introduce herself in a few minutes. De nuevo, mi nombre es Janet Pichardo. Gracias por asistir a nuestra academia. Nuestro título o tópico de esta tarde es Explorando carreras en cuidado de la salud. Entonces queremos asegurar que de nuevo las personas que estaban invitadas al taller de esta tarde eran específicamente los estudiantes de las escuelas secundarias de Providence y también sus padres. Entonces esperamos que vayan a aprender bastante sobre más oportunidades que existen ahora mismo en el estado en cuanto a la salud y el bienestar. Entonces, so basically what I'm going to do before we get started, I am going to just share some norms. Lo que voy a hacer ahora es compartir unas normas. De una vez que ya mencione exactamente cómo los padres pueden acceder en la interpretación al español, voy a completamente decir todo en inglés. And so for our families that need Spanish translation, as soon as I go through the first bullet, which is helping them understand how to access the interpretation services that we have this evening that's being offered by our friend Delia Rodriguez Masjuan. So she will help us out with translation. So again, para los padres que están necesitando traducción, si pueden mirar la pantalla hacia abajo, van a mirar que hay un globo y se llama interpretation. En inglés es interpretación. Entonces, cuando presionan el globo, le va a dar la opción de elegir el idioma español. Por favor, escojan el idioma español y de una vez lo van a entrar a un canal que van a escuchar en la presentación específicamente en español. If you are joining the meeting from a phone or a tablet, for those that are needing interpretation, you will need to press the 3 little buttons, and then you will have access to interpretation and choosing the option there. Para los padres que necesitan traducción, si están en esta llamada ahora mismo por medio del teléfono, celular o una tableta, seguramente no ven el globo, pero sí van a ver esos 3 puntitos. Cuando lo presionan, van a ver la opción de poder elegir el idioma para traducción y le va a aparecer el idioma español. Ahí entonces pueden presionar y tener de nuevo acceso al servicio de traducción. So write your question in the Q&A. So at the very bottom, when you see the icon Q, the letters Q&A, that is going to be the way that we will interact this evening, at least one of the ways that you can actually pose any questions or comments. So when you press it, a window will come up and all you have to do is type in your question. So para los padres, I'm sorry, right, we have an interpreter. So again, if you need to write a question, please write the question in English or in Spanish in the Q&A icon at the very bottom. We also have the option of raising your hand. So the little hand, if you press that icon, we will see a hand on our end. And what we will do is call on you. So we will call your name and then you will appear on the screen. And then we will ask you to please unmute yourself and you will be able to ask the question in English or in Spanish. And I will help translate the question if the parent asks the question in Spanish. And so you should also see the chat feature at the very bottom. The chat feature is not available for you to enter any information or comments. You will be able to see the chat only to see announcements that we will be writing into the chat. Okay, so if there's something that we want you to know, like we'll remind you of these icons and these instructions, but we will also later insert a link that we would like for you to open up, and it'll open up some questions that we would like for you to respond to. Okay, so again, our presenter, obviously we will allow her to present and we will try our best to make sure that we can answer all the questions that will be posed by parents. Okay, and so some of you, our parents, are probably accustomed to seeing Zoom or being on a part of Zoom, but in the way that you can see everybody's faces. But this is a webinar format, and so therefore you will only see the presenter and those of us that are on the team making this possible. So, so that is going to be the difference, and also the difference where you will be using the icons that I just mentioned. And so again, the presenter will try to answer as many questions as possible. We are working with the interpreter, so we are asking our presenter to try to keep to a certain pace in terms of our interpreter so that our interpreter can keep up with her pace in terms of her presentation. The microphones are for all attendees will be muted unless the attendees raise their hand, and then we will ask you to ask your question live. Again, as I mentioned earlier, there is a feedback form. We will provide you a link that you will complete a feedback form. We want to hear from you. We want to know whether or not, if you have any comments that you would like to add in terms of getting better, in terms of this particular topic, if there's anything else that you would like to learn from in the future. We want to get better at the activities and the topics that we are offering all of you. And we listed here the website, our Providence Schools website, so that way you can see the list of the different workshops. But also you received a text today and also a few days ago with a flyer that was also included, and it has the list of all the workshops in English and in Spanish, and we also added the link. So today is this workshop, but we have another one on Thursday, and then one in May. We have a few in May. So just make sure you can save this Zoom link and be able to come back to another workshop in the future. Okay, this is the list of the drawing. We will have a drawing later on once Ms. Victorino is done with her presentation. We will proceed with a drawing and also, again, requesting your feedback information. And this is the list of our workshops for this month. Again, we have for today, April 13th, Exploring Healthcare Careers. On the 15th, on Thursday, is Virtually Advocating for Your Child. And then on the 29th, Managing Daily Stress for Families. Okay, and we have some more in May. Okay, so I'm going to stop sharing my screen. And I'm going to ask Ms. Victorino if you would like to share your screen and share your presentation, please. And you'll have to unmute yourself, Sandra. Okay.
Just 1 second. Let's see, here we go. Okay. Hi, everyone. Thank you so much, Janet, for having me, and for everyone else for your interest in this topic. I do appreciate sharing any information that I can always, I love for people to have knowledge and to have the information that's necessary in order to be able to help themselves or their children succeed. So happy to be in this space and happy to offer any of my expertise that I can. So I'm Sandra Victorino. I am a licensed mental health therapist by trade, but I do work in human resources at Care New England. I'm the Director of Workforce Development and Community Relations. I transitioned to human resources this year, but I have been doing workforce initiatives for most of my career. I am really interested in helping people be in their passion lanes, having good employment in order for them to be successful and to succeed and grow within their field. So today I'm going to be talking about employment opportunities in healthcare, and just kind of giving an overview of what it looks like in a hospital system. So Care New England is actually made up of 7 operating units. And the reason I explain that is because given my experience of being at the Providence Center, which is a community mental health center, I have been able to see and grow as I've been there. I've been at the organization for 10 years, and because it became part of a healthcare system, which is all the hospitals, Women and Infants, Butler Hospital, the Visiting Nurses Association, Kent Hospital, and then there's a lot of different medical practices throughout Rhode Island. I was able to have exposure as a first generation Mexican American professional. So I had never had experience like this, and it was very important because it was part of how I was able to grow into my profession, because I was in a space that was able to teach me. So I'm going to jump right in. So what do jobs look like in healthcare? So jobs in healthcare can be many things. I know a lot of people think about our clinical jobs, which are doctor, surgeon, nurse. That's what I always hear when people are saying, I want to be in healthcare. And healthcare is actually all of these jobs that I have listed here. And these are just a few. So when I think, when I was younger, I thought that I couldn't become a doctor because no one in my family was a doctor, and how could that possibly be? But there's another track for people that really want to do that kind of work, but not to that level of time commitment to go through school. So someone can become a nurse, and a nurse can go and get their associates and get their licensure by going to a community college. And then from going to a community college, they can go on to a bachelor's and get their bachelor's in nursing. And then from there, they can become a nurse practitioner or go into becoming a physician assistant. So, and they also, nurse practitioners and physician assistants, help out within the doctor role. So there's different ways of being able to become something or specializing in something. But then there's, I've known people that have been CNAs and medical assistants and become nurses, or they become therapists and they go into behavioral health like I did. I also speak Spanish. So for some time, I was also an interpreter. So I've gone from being an interpreter to working in the practice and doing all of the billing and the coding, and then learning how to file charts for a hospital, for a medical office, and then becoming a therapist. And as you can see, now working in HR 15 years later. So there's a way to grow. And so we have different jobs here. The technical jobs are, the important part with technical jobs is that it's really looking at which technical space. So like a lot of people end up going to colleges that charge a lot of money, but then there's organizations such as the Cranston Education Center that can help you become a phlebotomist, maybe a lot cheaper than like one of the technical schools. So it's really doing your homework on how much you're paying for some of these technical classes. CCRI right now is starting to look at how to make sure that their certificate programs can have college credit. So that way someone's not just getting a certificate, but they're also getting college credit and continue on with their education. So important different things to know about how to grow within healthcare is important, because we don't want anybody wasting any money or time. Time is really important for some people. Time was really important for me. I needed to be able to be in my profession so I could be able to sustain and make my own living, so my parents didn't have to worry about me anymore. So time is important. And again, there's other jobs such as, working in human resources, and working in human resources can mean so many different things. Someone can be an assistant. Someone can be, there's a lot of starting positions when people go into something like human resources. It's just not the person that's hiring and firing. There's many different things that are going on in between. Security, maintenance, facility, dietary, nutrition, culinary. We have cafeterias in hospitals. Someone needs to make the food. Someone needs to serve the food. Someone needs to give the patients the food. There's such things now as mental health workers and peer specialists, people that have had lived experience with behavioral health issues. can go through a certificate program in our state and end up finding employment in as a peer or a mental health specialist or community health worker. So there's different ways of being able to grow in the field of healthcare. So let me move on to my next slide. Very important, volunteering and internships. So those that and Janet informed me that you guys had a conversation about volunteering. And so on here, I put the definition, but why is it important to volunteer? Volunteering is extremely important for those that are trying to build their resume. So if you haven't worked in some time, or if you've never worked, volunteering is an excellent way to put something on your resume. And I hear that there is volunteer opportunities within Providence school system. And so please make sure that, use your resources. That's what I tell everybody. But volunteering in a hospital system can be greeting patients, really being able to see what else exists in those spaces. So there's different departments that take on volunteers in our different hospital systems. But we're looking at really how to build your resume. So like I gave an example here about Providence College. Providence College has several multicultural scholarships. And one of the things they're really looking for is how involved is someone during their high school years before they end up applying to college. So there's different ways of being able to do that and continuing to volunteer before someone graduates high school. So small things, like I remember I used to take my sister, I would help back in the day with the American Cancer Society, and they would have a relay for overnight, and we would be there and we would volunteer, and she would do that every year, and it was super important. She was able to finish college with only having like $5,000 in student debt, where for someone like me that didn't have those resources, I wasn't able to apply for certain scholarships, nor did I think I could apply. But now that I have more knowledge, most of these scholarships are based on the work that you do for your community and not necessarily your GPA sometimes. So it's really important that if you're not strong academically, that you show your skills in another way, or help the students see it in another way. And then internship opportunities. Internships are really important to be able to start getting your foot in the door. I always tell people the soonest that you can get connected to an internship when you're in college, the better. Even when you're in high school, there's some of our programs that are connected to help students get into internships. And so it's really important to start looking at what your resources are and how to be connected to those. We do have a page, and most of our hospital systems have a page where you can fill out what it is that you have an interest in doing. So just being very clear whether you want to be a volunteer or you're looking for an internship, because it matters. The internship is normally tied more to the school, and what we want to do is make sure that we're placing you where is going to be the best place for what you're trying to achieve. So really important to be clear about that. So the benefits to doing that is like I said, connecting you to your expertise and really starting to help develop an idea of where you want to be once you complete school. You get to make connections with a lot of professionals. It's how I got my first job out of my bachelor's into my master's. It was extremely important. That person that I was in that job being an interpreter, she was actually my mentor and encouraged me to go forward with my education and said, I'll support you and you can work here 15 hours if you go on and get your master's. And I did. And I finished my master's when I was 24 years old. Had I not had someone like her, I don't believe I would have been able to be successful while in graduate school. it was extremely important because she taught me how to navigate through those things. So from internships, sometimes we can develop mentorships, and those are really, really important. So, and then I put on here fellowships because I didn't learn about fellowships until I was much older, but fellowships are important. And I attached a link for an article because it explains further. Fellowships are normally tied to a certain discipline, and going into when you're specializing a little bit more into your specific profession. So I would say read about it, learn about it, because it's super valuable. It's another way to get paid. And so that's really important and really exciting way to connect in doing your work with different people. Like I've known people who have gone in fellowships outside of, Rhode Island and gone to, or outside of the country. So just another possibility for things. And now I'll go to the next slide. Jen, is there any questions or anything that I may be missing?
I was going to ask you if you could, there isn't a question yet, but if you can just provide some guidance on where would someone, when they go to the website, it's either to the website or they can go physically. I know COVID right now is a little difficult for that, but where would they go to find more information about the various types of internships available at the different hospitals?
So they normally,
institutions.
Yeah, so most
Oh, I'm
places.
sorry, Sandra, I'm sorry. Let me try. Well,
Oh, go ahead. Oh, you go ahead. No, you should do that.
no, Delia's going to translate.
Okay. Sorry about that. So one of the ways of being able to do that is there is normally a volunteer or workforce page on all of the different hospital systems. And on there, they'll have the options like Lifespan has good program setups for high school students, and they were doing that work before COVID. We do a lot of work when it comes to helping people grow once they're there. Care New England does. And so we have been we were starting to do a lot of work with our youth. However, with COVID, that slowed down. So right now, at least at Care New England, we can't allow anybody to volunteer or do an internship unless they're 18 years and over because of COVID regulations. However, we are still trying to think outside of the box on how to allow people to volunteer remotely, because I think it is important for us to create pathways for our youth. I hope that helps a little bit. So who works in healthcare? And these are all people that I had because I had the pictures and I've already been working with them. So this is the group of ladies that you see underneath the community health fair. That was a team that I worked with, and they all have done different things. Some of them have gone on to become therapists. They were case managers. Some of them were interpreters, and then they became a case manager. And so it's important to see, so anybody can work in healthcare, any skin color, any person, and we all it's super important for us to have diverse communities in healthcare, because it's a way that we can help with healthcare disparities and making sure people see themselves when they're seeing their providers. So there's a picture of my nephew that I put on there. He's a biochemistry research person that he works at Rhode Island College. The first one in the family to stay in college, to go to college and live in the dorms in my family. And it was important for him to have a tia that knew how to provide him that support. As a mental health therapist, I knew how to provide him the support because it was difficult for him. It was difficult to be able to do that. So using your resources are really, really important once kids are starting to go into college, is really figuring out how to advocate for them and support them through that coursework. The woman below that's holding that sign at the RISE conference with me, she's the VP of Finance at Women and Infants. So she started in finance. She worked her way through, and she's the VP. So she took the same kind of ladder approach that I took, and it's just continuing. Again, she talks about mentorship and making sure she had the right mentors to be able to help her, because it's hard when you're one of the few diverse people in those leadership roles. And so we all support each other. And the two ladies on the that have their arm around me, those are my two sisters. So the one in the purple shirt, she is actually going back to nursing school right now, and she's 6 weeks till she finishes. But she's been a CNA, she's been an executive assistant, she's been an interpreter, many different things in the field. And the one in the middle is my little sister, and she's an ED nurse. After she became an ED nurse, so she started off as a CNA and worked herself she got her associates, and then she went to go work at a hospital, and the hospital paid for her bachelor's that she worked for. And while she did her nursing, and she had about 5 years in the emergency room department experience, then she became a traveling nurse. And so she started to live all over the United States because she wanted to experience that. And they paid her. I mean, I have my master's and they ended up paying her more money than I was making. But it's beautiful to see people my older sister has taken a very non-traditional route to going into healthcare. And my younger sister went straight through as well. But she ended up going by getting her associates first and then going on for her bachelor's. What are the benefits to working in a healthcare industry? It's job stability. I mean, as we can see that right now with the pandemic, it was one of the things that we did have. I didn't have to worry about my employment because I was working in the healthcare system. But it's also, there's different things that come along with that. So you have the pay and the benefits. There are certain places that, you have certain increases that happen every year. Sometimes that doesn't happen. There's things, you can start your retirement, which I know, for kids, it's like, retirement, but it's important. People want to stop working at some point. So retirement's good. But those opportunities for growth and upskilling opportunities are just amazing. I didn't know about a lot of them until I started to do this work as the director of workforce development. But there's a lot of programs in our state that are really wanting to advance those that are in positions that want to grow. So like, right now I'm trying to do a program within the hospital that is trying to grow those that aren't that are like front desk or medical assistants that want to be interpreters, trying to help them grow in our hospital. So once you're in the system, sometimes there's opportunities that can help develop you. Tuition reimbursement, we offer $2,500 a year. So it, $2,500 doesn't seem like a lot, but it's a lot. It can pay someone's books. It can do a lot of work, but also there's, again, those other programs that sometimes appear. Like there was a program that helped people that were nurses, associate level nurses, become a bachelor's level nurse, and they didn't have to pay for it. So it was just being part of that program. Exposure and stimulating work environment. So exposure is really important. I would have never had this job had I never worked in a healthcare system. I was just supposed to be a therapist. But then I found out that I had other skills. I had other abilities of being able to help people grow and teach them and really help them develop into other things as far as professionals. I've helped case managers that have come in, they were working at Home Depot, and I saw that they had the ability to be a leader. And so they went from working at Home Depot, coming to working as a case manager, to being an assistant manager, to being a manager. And she liked doing that, but she really wanted to do research. So now she's working over at Butler Hospital because she made that connection at Butler Hospital, and now she's doing research over there. And so it kind of helps you have these transferable skills to be able to move within the spaces that you choose to. And then helping people in the community. I love doing what I do. I loved being a therapist for the community. I loved seeing individuals. I love providing them treatment. I love doing this too. I believe that everybody should be able to work where they want to work and be in their passion lanes. And then important information when applying for employment, internships, and resources. The reason I put these resources on here is because this is what we have in our state. We have Network RI offers job coaching. Be specific with what you need or what you're needing for your child. Skills of Rhode Island offers career workshops. They're free. They have programs like Prepare RI for high school students and others. And then I put down the website and the phone number because I know some people may feel more comfortable calling. You have some people are near the Genesis Center. The Genesis Center does a lot of job training as well. But the other important component of somewhere like the Genesis Center, Skills of RI, and Network RI is they have vocational specialists. So they have people that have gone to school to specifically help people and help them get employment. And so it's really, it's good because they also are looking at your resume, and resumes are hard to do for the first time. They're not an easy thing. So please, please, please use your resources to build them because it'll make it that much better for whoever is trying to apply for employment. And always make sure that you complete the application from start to finish, because if your resume is incomplete, then the person on the other end is not going to review it. So incomplete resumes never make it through. So it's super, super important to make sure you do that. And then if you need to do your resume, please, ask someone for help. It's really important. Like school guidance counselors, a mentor, use the community resources. It's really, really important to have a strong resume, and start working on it. Let's see. That's it. Do you have any questions? I think I saw a question and then I'm not good at multitasking, so I apologize.
It's okay. It's okay. So everyone that's on the call, please, if you have any questions, you have the option of writing in your question where it says Q&A at the very bottom of your screen, and you can write the question in English or in Spanish. If you prefer to ask your question out loud and live, then you can go ahead and press the little hand. It's called raise hand. And then we will see your hand raised next to your name on our end here, and we will call your name. And then we will ask you to unmute yourself. So again, please, if you have any questions, Sandra's here. She is definitely, full of information. She has the experience, has worked in the field. So if you have any questions, if not for yourself, but perhaps something that you think that your student may be interested in you, asking. So please just let's maximize the opportunity right now. I did want to ask, in the meantime, I'll let you think about it, but don't forget, okay, either raise your hand or write in your question. I did want, Sandra, if it's possible, if you can just clarify in terms of the various hospitals here in Rhode Island, the growth opportunities. Can you just explain, are there growth opportunities, for all, if not careers, but positions within the hospital? And I'm saying hospital, but I'm sure that you also refer to like the different health institutions. But I guess, what should a person look towards in terms of growth opportunities, or do on their own? Do they have to actually get more training outside of the health institution, or does the health institution offer you training?
So the different hospital systems that we have here in Rhode Island. So we have Lifespan, that has a little son. Care New England has the hands that makes the heart. And then we have Charter Care. Charter Care is Roger Williams Hospital and Fatima Hospital. And then we have South County Hospital. So system. So they have a system down there. And Lifespan has many different systems within one, like Care New England does. And so when I tell people, you know, think about sometimes when you're applying for a job, I think as systems, we don't always do a good job of explaining exactly what area it's in. So that's why I say, if you have any questions, whether it's today or tomorrow, please contact me. I can certainly help you walk through or navigate that careers page, or even the volunteer internship if you have additional questions, because sometimes those systems aren't as great as we would like them to be. So that's why I'm here, and you can see me and see who I am, and feel free to contact me. So that was one part of the question, and then I can't remember the second part, Janet. I'm sorry.
I think it was more.
If they want a growth opportunities. So when we're thinking about growth opportunities, one of the things that I often tell people is to make sure that you ask, stay informed, because sometimes communication isn't always brought to everybody. And I think that it's not intentional at times, where, you know, I think every system is trying to do better, but it is important to say, you know, this is what I'm interested in doing. You know, once you start to become familiar with your role, I always encourage people to say, if you're not being asked, to say, you know, is there any growth opportunities? Are there any trainings that happen or that I can see? I'm hoping that organizations can be a little bit more transparent, and I'm trying to make sure ours is as well. And we are trying to do a really good job of being a little bit more transparent about opportunities, but it doesn't trickle down as easy as we would like it to. And so, but there are opportunities, and I think for the most part, they are for all of those that, you know, are eager to have them. Performance evaluations are a good way for that employers end up really seeing who is interested in growing. So I always tell people, like, make sure you stay on your game, and make sure that if something's happening at home or that things are changing, just let people know, because it's important to see if your employer can help you. Because sometimes there's resources I wish I would have given some employees, if they would have been able to tell me, like, or just say, hey, I need a resource for this, or this is kind of what's going on, because, you know, you don't want to tell your employer sometimes too much, but, you know, this is what's going on. And so then I could give them a resource for it, and they can, you know, then figure out how to work around it, because there's a lot of benefits in that. There's a lot of benefits in organizations to be able, if you need time off for your family, if something's going on, and instead of not showing up to work. So we'd prefer for people to be open in communication than not show up for work and not be able to be successful in their work.
Okay, thank you. We do have a question. It's in Spanish, so I'll read it in Spanish and then I'll translate it to English. Yo sé que se está enfocando en los jóvenes, pero por ejemplo, yo soy una CNA y me gustaría saber si hay algo de ayuda para los padres. Gracias. And so in English, I know that you are focusing on the youth, but for example, I am a CNA, and I would like, you know, to know if there is any help for parents. Thank you.
So for parents, it depends on the organization someone's working in, but like sometimes like I know right now that there are programs in some of the nursing homes and helping, you know, or in the conversations. I'm in a lot of conversations about how we support CNAs and how we help them grow. So that's happening right now. I would imagine that within the next year, there will be more possibilities for someone to grow from, hopefully to grow from a CNA to a nurse, because they're such similar tracks. But if someone, it really depends on where they want to grow into, and being in a healthcare system is one of the easier ways. So like, I know the nursing homes is one of the places that has been focusing on really advancing CNAs. The hospitals have been doing that too, the community centers. So just making sure that wherever you are working, you're asking for opportunities, because if that comes in our state, then hopefully people will take advantage of it in the different organizations.
Sandra, I had a question.
Yes.
So you had mentioned earlier as one of the professions being community care worker. That's a word that I'm hearing a lot. I was just wondering if you can explain a little bit about what that job title means, and how somebody would go about going through that process of getting a job in community care work.
So the community health worker is the RIPEN, I believe, has a program, and through the state. So you actually can, and if you Google community health worker, it comes up back in our like state profile. And it's someone that provides assistance. It's the community liaison. It's almost like someone that is providing, it's that bridge for the community, the person in the community and that community health center. So they're the ones that provide the information. Normally some people have been living in certain communities for a long time, and then they end up getting the certification, and then they end up working for different community health centers. A lot of the community health centers have the community health workers. So like at Clínica Esperanza, we have someone that works in one of our Integra offices. So different, that's what it kind of is. It's like making sure that the person that needs the care is connecting to the doctor. So it's like making sure that they're understanding the information and that the person is following through with their care. So it's similar, it's a little like a case manager, but most case managers have to have an associate's or a bachelor's, and a community health worker can have the certificate program. And then they can grow into case managers. You know, we're in desperate need of mental health providers in this state. You know, mental health is necessary. We all kind of need that right now. And so the community health workers, some of them are starting to get behavioral health certified as well, because there's a certificate program actually at Rhode Island College that helps them have a better understanding of the mental health needs of our communities.
Okay. I do have another question. In terms of, well, we're getting close to the end of the school year. You know, I'm sure the youth are thinking about summer jobs. So I'm just wondering if you can share, you know, the school department provides working papers for our youth, right? And so just wondering if you can share, you know, the process in terms of our youth being able to possibly gain some employment over the summer. Is it too late? I mean, we're in April now. I'm not sure if that process.
No, I think it would be important, regardless, for the youth to go either through both, you know, the workforce development sites, volunteer sites of any of the, you know, healthcare systems that they choose to be part of that are close to them, right? I would say still inquire, because they might have, you know, been like, no, we're not doing this because no one's asking for it. But if people start asking for it, then they might say, yeah, we need to run it because it's important and we need to make sure that we're offering this service. So it's kind of the way that we started having interns back in the hospital. And so we're starting to have the volunteers back. So we're at a point where we're starting to be able to make those changes. So I would say if someone has a specific interest in a specific space, please reach out and ask about it. There's no harm in asking. The worst thing someone can say is no, but I would say reaching out is great, would be great.
I have another question. In terms of, so I know that you showed a screen that had the different roles or positions within the hospital. Just wondering if you could mention what might be some positions that perhaps there are shortages, because I mean, we hear a lot about nurses, if there being shortages for nurses, but are there other positions also that you can mention, again, just for anyone who's on the call that might want to be in the healthcare field, but still not sure, but also wanting to know, is there a need for specific positions?
So a lot what we hear right now is the medical assistant, CNAs, nurses, mental health therapists. So a way of becoming a mental health therapist is by going, community health worker or peer specialist to becoming a case manager and then becoming a therapist. And behavioral, like I said, behavioral health is just important for everybody. But I think those would be the major roles that I really have seen there be a struggle and a need. And I'm trying to see if there's anything else. Right now, we're like in certain hospitals, we're in really dire need of dietary and nutritionists. I know at our Butler site, we have, there are some positions that are part-time or that are part-time or flex hours. So like they're less hours. So that sometimes some of them are, or per diem. So that means that, they'll let you know when they need you. And sometimes those are ways of being able to get into these systems as well. So I always tell someone, if you have the ability to just apply and then work when they call you, then by all means, it's, it's a good way to get your foot in the door somewhere. But even like these part-time ones that are 24 hours are good ones to be part of, because it just allows you to start seeing what's there.
And then, Sandra, just a follow-up question to that. Now that you identified the professions that are most in need with healthcare, are there any like colleges or universities that are partnered with the medical field, so that way, if someone from, let's say, that is graduating Providence schools wants to go into the field, they can go to streamline their way into the healthcare field that they desire to get into?
So I always tell everybody to take advantage of CCRI's like pathway. Like, you graduate in Rhode Island and then you can go to CCRI and then from there transition and transfer. I am in a community college graduate as well. It made my student loans a significant difference. So that's what I always encourage people, especially if they don't know exactly what they're wanting to do. But are wanting to explore. That's a good way of doing that. But, Rhode Island College has, most of our colleges have a nursing track. So Rhode Island College, URI, Salve, Virginia, we have such an ability here. But like if someone wants to do business and finance, I would say Bryant is one of the best colleges to go into here in the state, as far as when it comes to that. They know that well. It's looking at where you're going to feel the most comfortable. And I say that because I've had a lot of students that have gone to some of the colleges around Rhode Island and haven't felt comfortable, and then they're unable to complete. So I would say using systems like the College Crusades, talent development down at URI. Those are some of the most, the students or the people that I've encountered in the workforce, and the ones that are growing. and continue to grow because they have a support system that helps them continue to grow.
So Sandra, would you say that right now there is a good number of job opportunities within our hospitals?
Yeah, I do. I would say that right now is a very good time to be able to go and apply and seek employment. It's really a crucial time for and a need. I think there are some people that realized throughout our pandemic that healthcare wasn't for them, and so they exited the field. And so it leaves room for those that are currently interested in it. You know, for me, it made me feel that much more pride to be working for a healthcare system. I was super happy to be in the action. I was actually doing crisis work when at the beginning of the pandemic, and I transitioned into this job in November. So being in that space and helping my staff and doing that work was super important for me and extremely valuable. And it made me super happy to be able to be part of a system like that. But there is opportunity right now. And I would say anybody that's interested, please, and needs help navigating the system, like I said, please feel free to reach out.
Okay. I was just wondering, for the parents that we might have on the call, I know there was one that mentioned that she was a CNA.
Yeah.
You know, so for families that might be interested in pursuing, let's say, a career in CNA or that profession, I know you mentioned the Genesis Center earlier.
Mm-hmm.
Are there some specific, organizations that right now you would recommend?
So I would say the Cranston Education Center is another one. They do an excellent job of helping with CNAs. I think I do believe CCR may have a track as well. And I think connecting to some of our school in the system like that sometimes makes it beneficial because you can continue to grow, and they help you understand that. But if you're looking for and Genesis Center, I just actually went on their website and they were saying that they were going to start doing their programming again soon, because a lot of the programming had to stop because of the pandemic too.
Mm-hmm, mm-hmm. Okay. Well, we don't have any more questions, Sandra, and our audience haven't posted any questions right now. And so I guess I want to ask you if there's some last comments or some tips for our youth that might be, let's say, considering the healthcare field. If there's anything that you would say that while they're still in high school, would you recommend certain things that they should be researching, just to see whether or not this is an interest for them, depending on whatever it is? What would be some advice that you would have?
So I always tell someone, if you see someone or you meet someone and you're like, man, I'm super interested in what they're doing, go to their LinkedIn profile and see what they've done to get where they are. And the reason I say that is because it's a template and a model to be able to help someone see the trajectory that someone took to get to that role. Because it takes some time sometimes to be that person, right? But at the same time is that went through these steps. I've reached out to people on LinkedIn that I've seen the jobs that they have, and I'm like, can I ask you a question? How did you get there? And a lot of people respond. So it's really important that when you identify what it is, and when you're going to the doctor's office, pay attention to who's doing what for you, and say, could I see myself doing that? Is that something that I would be interested in? And ask them questions. I asked the phlebotomist. That's how I learned about the Cranston Education Center. She was super happy. She was taking out my blood. She's like, I go, do you love your job? She's like, I love my job, Sandra. Been doing this for 5 years. I went and I spent money in New England Tech. And she's like, and I was supposed to be a CNA. And then my friend told me about this phlebotomist program. I came and I took it, and I have this job, and I've been here for 5 years, and I love it. And so ask your providers questions. If you go to I used to ask my optometrist questions when I used to go to the eye doctor, because I thought that's what I wanted to be. And I really was supposed to be that. I was going to be an optometrist. And then I took my first psychology class, and I asked my psychology professor, like, do you think this is for me? He goes, take more psychology classes, see if you like it. And I did, and I ended up becoming a therapist. But be curious, don't lose your curiosity, continue to be curious. That's what I would 100% say.
Very good, very good. And to the parents out there, Sandra, when folks talk about the health field, they think right away is very expensive. It's something that, some may hesitate to encourage just because of the financial burden that it might bring about. So any advice for parents?
So I would say support them and find a way, because if that's where their calling is, they're going to find it later on. And, I've seen people go into finance and say, I'm miserable, I'm making a paycheck, but I'm not happy. And as a mental health therapist, I've seen a lot of people come to my office with just being sad and not happy with what they're doing every single day. We spend more time at work than we spend at home sometimes. So it's really important to love what we do. It's our second home. And if the parents can give their children the opportunity to have that, I say, please encourage them and find a way. People told me not to be a therapist because I was never going to make any money. It was not a sustainable job. I've never been unemployed, and I thank my stars for that. I've never, I've only grown, and I've been able to have such a community impact that I never thought I was going to have my whole life. But I was not encouraged to do this. And I say, if they have an interest, explore the interest with them and see where it takes them. Because there are certain programs, like to become a doctor. Sometimes you can do a master's within your doctorate program. So you get a master's when you're in your doctorate program. I didn't know that. So make sure you ask the right questions, help your children not waste the time, and do it in the best way possible for them. But I would say explore it with them.
That's wonderful. Thank you so much, Sandra. You've been so helpful, and obviously very passionate about the work. So glad that you're in that role. For those, for where you work right now, obviously they're fortunate to have you, and we're proud to see you in this role. Thank you so much for saying yes and delivering this workshop for our families and our students. So we want to thank you again. I'll keep in touch with you just to make sure we can reach out for our next Parent Academies next school year. So thank you so much for your time.
Thank you.
Yes. So Sandra, you can exit our call now. We will proceed now with asking some questions in terms of feedback from our audience. So we thank you again for
it's been a pleasure. Thank you. Bye-bye.
Bye-bye. And so parents, we are going to continue for another few minutes. We have some giveaways that we would like to share with you, but if you can look at the chat, please go at the very bottom of your screen, look at the chat, and you will see a link in a few minutes. The link is a feedback form where we will need for you to share your opinion, some feedback. We have just like 6 questions that we need for you to answer. They are in English and in Spanish, very easy questions. It will not take you long. So please take a few minutes to complete the Google form. Is it on there yet? Okay. So you see it now. If you can go on to the chat, please open the chat. It's at the very bottom of your screen. Click on the link and the questions will appear. So if you can just take a few minutes and answer these questions. And then if you answer the questions, you will be entered into the drawing that we will now move forward in sharing with all of you. So please make sure that you complete the Google form. Again, the items that I shared with you earlier were items that were 4 free admission tickets to Roger Williams Park Zoo or Park. So family of 4. So we have 1, 2, 3, 3 that we will be drawing in a few minutes. We have a $10 Walmart gift card. Actually 2, we have 2. And we also have a $25 gift card to Nice Slice, which is a pizza place right up the street here, right across the street from Classical High School. So in a few minutes, you will see a timer on your screen, which is just giving you some time to fill out the Google form. And then we will move towards making sure that we can have some of you win these items. So again, please take a few minutes to complete the Google form. I'm not sure how many of you have completed it, but I am hopeful that everyone that's on the call, takes a few minutes to complete the form. Remember, your feedback is super important for us. We want to get better at the options of the topics that we're offering for the Parent Academy. So without your feedback, it's really hard to think about what might be some topics that parents enjoy, can also grow and think about opportunities for yourself and also for your students. So please make sure that to take a few minutes to complete the survey. I wanted to also remind all of you that, again, we have other workshops that are coming up. We have one on Thursday. It's virtually advocating for your child. And so make sure to tune in, to the Zoom on Thursday. You'll receive another reminder. But if you save this Zoom link that you use this evening, it will take you into the workshop for Thursday. So we have another one on the 29th, and it's called Managing Daily Stresses for Families. So we know that, on a daily basis, we can go through some stresses. So please join us on the 29th to get some additional information on how can you balance, your daily obligations, and just in general, how do you balance everything to reduce the anxieties and stresses that life gives us sometimes. But I also wanted to just take a few minutes and just share that the Family and Community Engagement Office, hosts these parent academies. And it's all with the intention of making sure that we inform our families, that we involve you, because we want to make sure the more information you have with regard to different topics, including the academic support that your students, will need, that also will help you make sure that your child is successful in school. But in terms of our office, we're here to help every family. It doesn't matter what program your child is in, what grade your child is in. But if you call our office or come visit our office, we will be happy to help you. Our phone number here is the 401-456-0686. I'm going to put the number on the chat so that way you can, be happy to, just call us at any time. We have a voicemail. You can just, leave a message if you have any questions. Again, we're here to help you out, to provide guidance, but also to answer any questions that you have or any concerns. So right now, if you have any concerns, obviously, we always ask you to reach out to your school teacher, your child's school teacher or principal. But if there might be some reasons why you may not feel comfortable doing that, you're welcome to call us. Again, our number is on the chat. It's 401-456-0686. And make sure, to just leave us a message if we don't pick up. But during the day between 8:30, 4:30, someone should be able to answer the call. I also want to remind you to just pay attention to the different messages that we send you, either by text or by email. And I know that if you have more than one child in the district, you may get several messages, but we have to keep trying to get information to you, because we know that this is one of the best ways of reaching out to you, which is through a text or through an email. And so we have a minute and 31 seconds. So please, we're allowing you enough time to be able to complete the Google form. Again, if you look at your chat, open up your chat and then click on the link, and it'll open up and the questions will appear. They're very short and fast questions. So we just want to make sure that that you tell us exactly what you thought about this workshop. We know that there are opportunities out there, and in offering them through this platform, in this case, the Parent Academy, is one way that we can help you out. So again, our number is 456-0686. Any questions that you might have, it doesn't matter, if it's for elementary, middle, or high, just reach out to us and we will be happy to help you in any way. And so we have just a few seconds. Okay, we only have like a handful of participants who completed the survey. Please take a few minutes, go to the chat and press on the link. Okay, so we want more of you to please, because again, if you complete the Google form, you will be part of the drawing. So it's not everybody that's on the call that will be part of the drawing. So we were asking you to please make sure that you complete the Google form. We're gonna wait to see if at least 2 more people reply to the Google form, so that way we can proceed with the drawing. Okay, so again, we're gonna wait one more minute for someone else, just extending it 1 more minute, and then we can proceed. You will see on your screen, pretty soon, you will see a wheel, and the wheel will have the names of the folks that are part of the drawing. Okay, and then you'll see it go around. It's almost like the Wheel of Fortune, like a game. And I will be announcing the different prizes. Okay, so again, I think that we should be all set with folks that have completed the Google form. So just in a few seconds, you will see the wheel appear on the screen. And for all our winners, just so you know, whoever you will be, we will connect with you afterwards to make sure that we can arrange the pickup of your prize. So here's the wheel. Wherever it stops, you are the winner for the family 4-pack of free admission tickets. Okay. So again, the family 4-pack free admission tickets. Let's see who's going to win this. The first prize. Okay, Modernat. Okay, so Modena, we'll get back to you. Congratulations. We will call you so you can stop by and pick up your tickets. The next prize is the $10 Walmart gift card. Again, the wheel is going around. Let's see who wins the $10 gift card. Okay, Paula Mejia. Okay, we will call you, and so we can arrange the pickup of the gift card. Next prize is, again, another family 4-pack free admission ticket. And who's this? Fanny. Wow. Fanny Flores. All right. You won the tickets, the family 4-pack tickets. Yeah. So we have 2 more. We're going to do the $10 Walmart ticket. Gift card ticket. And who's this? Julio Gonzalez. Yeah, so we have 1 more person, and we have our last prize. That was the Nice Slice $25 gift card. So that's going to be automatic for you. So thank you so much. We will call you and make sure, Almedia, to arrange and pick up the $25 gift card. So that ends our Parent Academy for this evening. Thank you so much for joining us this evening. Again, we hope that you join us on Thursday. Please don't forget, the workshop on Thursday is at 6 o'clock. It's the virtually advocating for your child. Expect a text reminder or an email reminder. Just know that the Zoom that you use this evening will allow you to come back into the workshop on Thursday. Okay, thank you so much. And thank you, Delia, for helping us out with interpretation. Have a good evening, everyone.